Hello, everyone, and welcome back to the show. Today, we are talking about everything is fine and the other lies that we tell ourselves and how this affects our health. So before we get into it, I just want to remind you that this show is about classical Chinese medicine. So if things are not making sense to you, or there's something that you feel like, wait, I've never heard that before, probably because it's classical Chinese medicine. So please feel free to connect with me over on Instagram so you can participate in the discussion, ask questions, make comments, that kind of thing. This helps me know what you need to know to help you understand classical Chinese medicine better than you do. Most people at best are familiar with traditional Chinese medicine, which if you've listened to my first episode, that was about how TCM was created. Traditional Chinese medicine was created in the 1950s, and it was created from a very small part of the full system of acupuncture, which would fall into the category of classical Chinese medicine. So if there are things that aren't lining up for you, or if you're not familiar with anything outside of allopathic medicine in general, like I said, connect with me on Instagram because I want to answer your questions, and let's have a conversation and talk about it so that we can understand better. So today I want to get into how the emotions affect our health and why it is so harmful to just say everything's fine. We have a culture of toxic positivity, and I used to think that this was specific to my experience as a person from America and also specifically from the South, because the South seems to be very much all about things looking nice at all times. But as I got deeper into this practice and developed relationships with people across the world who were studying with my wonderful teacher, Ann Cecil Sturman, I heard their stories about their own experiences as well as from their patients. And it really enlightened me to this perspective that in general, as humans, we are woefully underskilled when it comes to emotion. And it is a very common human characteristic to say everything's fine, even when it's not. And when we tell other people everything is fine when it's not, it reinforces for us that is a lie. And we're trying to convince ourselves that everything's fine when it's not. Okay, so first off, I find it super fascinating that neuroscientists say that an emotion only lasts about 90 seconds. Now, for those of you who are not familiar with this type of thing, you may be thinking to yourself, yeah, right. Like I've been feeling a certain way for a long time about something that happened years ago. For those of you who are not familiar with the idea of an emotion being a very quick experience, I would just say to you, just because something is common doesn't make it normal. It's common for us to hold on to emotions regarding a situation or an experience for years and years and years, but that does not actually mean that it's normal. So when we get into where our emotions come from, it is a response to a thought that creates the emotion. So the reason that I bring this up in a Chinese medicine context, and the reason that I talk about this with my patients as well, is because emotions affect the body in a very direct way. And so if our emotions are coming from the thoughts that we're thinking, we have to really dig into what those thoughts are and where they're coming from. So if we've been conditioned to think a certain way or in a certain way, then we're going to produce a certain emotion. But then if our culture tells us the only thing that is polite to talk about are polite, positive things, then we just say everything's fine. Okay, so let's get into the classical Chinese medicine. So as a review, in case you haven't listened to the first episode, the full system of acupuncture includes something called the primary channels, which are 12 channels that resonate with the organs. These would be things like the large intestine, the liver, the lung, the gallbladder, the liver, etc. Those exist to manage the function of the body 24/7. They also exist to express emotions that are associated with that organ. When that does not happen, that looks like a threat to the body, no different than if someone punched you, like if you had a traumatic physical injury, if you got very ill. The lack of emotional expression is going to look the same to the body. And so then the complement channels step in to whisk that emotion, that unprocessed emotion, away. And they store it in whatever channel is appropriate at the time. So if you've been around, you may have heard me talk about resources. The word that we use in classical Chinese medicine is mediumship. And the complement channels use mediumship to store that emotion for us. because it recognizes that we did not have the capacity to deal with it at the time. So the thought is, let's just hold it for you, and then you'll come back to it when you do have time. But the sad reality is that many of us don't come back to it because we don't have the time, the space, or the skills to dig into why it is that we felt that way. And so many, many years later, we develop chronic disease symptoms. We get that lupus diagnosis, that fibromyalgia diagnosis. We start having migraines. We have joint pain. We have maybe problems with the organs themselves. This tells us that something has been stored in the complement channels to an extent that it has exhausted the mediumship that is there. If you imagine all of these complement channels like some sort of container that is holding a lot of resources, and anything that our bodies come in contact with that poses a threat to survival, we're just going to store it in that container. We're just going to shove it down. And maybe it has different compartments, different levels, but we're just going to put it away. And then we can deal with that later, but we're just going to keep the container like as is for now, okay? But then the container is getting tired of holding, and is the stuff that it's storing is using that mediumship. It's using up the resource. And at the same time, we're just out here living our lives. Like, we're drinking coffee every morning. We're drinking wine every night. We're eating a dry diet. We put onions and garlic in everything we eat. We eat hot sauce on our eggs in the morning. We don't sleep as much as we should. Of course, we still have the fact that we don't handle our emotions well. So we're stressed and we're worn out from that perspective. All of those things are really depleting to the mediumship. So our lifestyles are depleting the mediumship that is also being taxed by the holding of the emotion that has not been acknowledged or processed. So we're getting more and more deficient, which means that we have more and more symptoms. This is also why it's very common, once you get one autoimmune diagnosis, to get another one, to have multiple diagnoses on board at the same time, because the first symptoms that you experience tell you that the mediumship is a little shaky. It's a little bit depleted. That joint pain that you feel when you're walking up your stairs in your house, you think it's just because you're getting a little older. You're not getting a little older. Well, I mean, you are getting a little older, but it's really that you're getting a little more depleted, not realizing it, of course, but you keep going, and then one day you get an arthritis diagnosis. People say your knees are bone on bone. That bone on bone is an example of where the mediumship has completely been disintegrated. And what I'm talking about today is how the emotion plays a role in making us sick. And that when we ignore the emotion that we experience, that we have, this contributes to the further depletion of mediumship, which means the further exacerbation of symptoms. So when in Chinese medicine, classical Chinese medicine, we are helping people with their chronic disease, the way we're doing this is through treatments that help channels realign to support organs to make more resources. And that's why we talk so much about diet and lifestyle choices, because we can be doing our best in an acupuncture session, but if you are also still living the same way that you have been living for years, and this means not just dietarily and lifestyle like exercise habits, like sleep habits, but also the mental component. When we are not addressing our emotional stuff, which can be very, very difficult because it is so insidious. It's deeply held and deeply buried sometimes. Sometimes we're not even aware that it's there, but we just always say everything is fine, right? I'm okay. It's fine. Things are great. This contributes to your depletion. And I just want to remind you too that while acupuncturists don't treat cancer, where we see cancer showing up is at the end of the spectrum of mediumship depletion. So at the point that you have depleted so many resources, you've gone down the line, down here at the end of the line, there is no more resource or mediumship to hold everything in the container. And that's when we see heat, what we call heat toxin. The heat that is generated by holding all of that stuff for years and years and years that has consumed the fluids, the resources, the mediumship, you can call it any of those things, then results in what allopathic medicine would call irregular cell growth. The lack of mediumship allows for irregular cell growth. The lack of mediumship allows for a toxic heat situation. And toxic heat almost always looks like allopathic medicine diagnosis of some form of cancer. Okay, so let's get into how we want to address this to prevent it from affecting your health. First thing that I recommend is tracking your thoughts. Literally just noticing what your brain is doing. The brain is a sneaky little bastard. The mind is a sneaky little bastard. It has all kinds of thoughts. It can go off the rails really quickly. And if we are not even noticing what our minds are doing, there's no way that we can change the script. So a lot of times people say, I can't meditate. I can't quiet my mind that long. And if I do, then I fall asleep. That's great. You're noticing. Just start there. The second thing I want to say about that is we're not trying to change anything yet, except the fact that you haven't been noticing what your mind is doing all this time. When you wake up in the morning, first thing, what are you thinking about? And a lot of people say to me, I'm thinking about the fact that I waked up late. My kids' lunches haven't been packed. I'm already behind. I have this thing that I have to get to at work. But first, obviously, I have to take my children to school. People have all these thoughts, and this is very common. But what I want you to do is start noticing what are the thoughts first thing in the morning. And as you begin to notice, then you begin to be able to shape them in a different way, just simply by noticing. It's like when your children are doing something that they know they shouldn't be doing, but then you come into the room. They see you and they notice that you're noticing, and that often prevents them from continuing doing the thing simply because you are noticing their behavior. This is what I'm talking about by tracking your thoughts. I want you to notice your thoughts because your thoughts, remember, are going to affect your emotional outcomes. Your emotions are going to be reflective of the thoughts you're thinking. But if you don't know what the thoughts are that you're thinking, there's no way that you can get to the point where you can deal with your emotions. Okay, so first we're tracking our thoughts first thing in the morning. This can literally be just noticing. The second level to that is writing it down. Just like jot it down in a notebook beside your bed. And then the third thing is I would think about this at night as well. When you get in bed to go to sleep, what are your thoughts? The second part to all of this is noticing what you are grateful for. This sounds like kind of a trite recommendation because everyone, or maybe not everyone, a lot of people like to talk about gratitude, but if you can break it down to something so simple that you are thankful for in your life, you start having gratitude as a thought versus what is essentially the opposite of gratitude. I'm behind. I don't have enough time. I didn't get enough sleep. I'm tired. I have to do XYZ. I have to do this thing, whatever. Gratitude is going to flip your script, but I don't think that you can do it by just saying, be thankful. Those signs, I should probably keep this episode clean and this show clean, but those kinds of signs about being thankful and like gratitude written in some sort of cursive font drive me up the wall because without knowing what your thoughts are to begin with, how can you shift to paying attention to what you are grateful for? This is my argument that I'm making. Toxic positivity is killing us. It is not a good or positive thing to ignore your feelings. That's why I'm saying pay attention to your thoughts. If those thoughts are angry, fine. If those thoughts are frustration, fine. If those thoughts are rage, absolutely fine. It's okay to have negative thoughts. You want to start tracking them. You want to start noticing first, and then you get to the point where you can challenge your thoughts, which will then also lead to a change in the emotional outcome. So to recap, first, we're tracking our thoughts, just noticing. We don't have to write it down at all. But the second level to that would be to write it down. Jot it down on a piece of paper, maybe in the morning, maybe at night. If you don't write it down, don't sweat it. It's not a problem. Just start noticing your thoughts. The second thing on the list is the gratitude piece. Thinking about two things every day that you're thankful for. You woke up in a bed. Your children woke up. Your spouse woke up. You have food to eat in the kitchen. You have shelter. It could be that simple, right? It can go deeper, certainly, but the basics that you have, I guarantee, are not the basics that everyone has. And I don't think that that should be overshadowed, but it also often is because we're always pushing for more and more and more. We're always trying to challenge ourselves to do the next best thing. And sometimes the basics get forgot. So I don't think that it is a trite thing to say we want to remember what we do have and what we have to be grateful for. And then the third thing that I alluded to in the first part about tracking thoughts is we're going to get into questioning the thoughts. So you wake up first thing in the morning and you're thinking already, I'm behind. Are you really behind? How does it feel when you believe that you're behind? That's a different question. How many days have you actually been late to school or to work? Are you actually behind, or do you just want to give yourself some more time? And then what I would argue is through this process of questioning your thoughts is that if every morning on a regular basis you are waking up feeling that you are behind the curve already, then perhaps we need to back up and think about what do we need to do to help you get up earlier. That's going to start at nighttime, right? So then do you see where I'm going with this? There are concrete steps that we can take to change our behavior so that we change our thought, so that we change our emotion. Okay, on this episode today, we talked about how thoughts shape our emotion and how emotion affects our health outcomes. If we want to change our health, we've got to change our emotion, which means changing how we think about something. So this is not some sort of woo-woo kind of thing. This is literally going to the root cause of a problem that you're experiencing. But MG, I lived in a house that had tons of mold. I had to move out and do a whole remediation. Yes, and a lot of people have that happen to them and they have no symptoms because their mediumship was solid. They had the resources to live in a moldy house. Now, I'm not suggesting that we should live in a moldy house, and I think it's important to remediate it. But what I'm saying is a lot of times people will hold an experience that they had out as a surefire reason for why they have the chronic condition that they now have. And what I'm trying to say is not everyone who has experienced that same thing will have the same outcome. And I think that this is because their mediumship was in a different place. And the biggest missing component, in my opinion, is that people do not have good emotional skills. We just do not, as a human species, across the world, no matter where you live. I've seen this through my colleagues and their patients. I've heard their stories. This is something that we are not born with, but that we do have the capacity to learn. So just to wrap up, we're talking about how important our emotional health is for our physical health, and how there is a direct connection to chronic disease when we are using the lens of classical Chinese medicine, which is obviously what we're here talking about on this podcast. If you have questions, please connect with me. The podcast is on Apple and Spotify, as well as YouTube. I'm over on Instagram, and all of that is in the show notes. So please connect with me, ask questions, make comments so I know more how to help you understand and live a healthier life. All of this sounds like magic, but really it's just medicine.